Hello and welcome to today's episode of Point of Disorder. This is one of our shorts, and today we're excited to introduce one of our favorite guests. You probably know him from his commentary on CNN or from his work as a physician, epidemiologist, and public health leader, particularly for revitalizing Detroit's public health infrastructure. We know him as a progressive activist and a fierce advocate for healthcare for all. Welcome to the pod, Abdul. How are you?
Always great to be with you. This is one of my favorite podcasts. Like, this space is amazing. Like, the pivot to video, love it. Just grateful to be here with you guys.
We are very excited. And just a reminder that this is Abdul's second appearance on our podcast. He was one of our very first ones last year in 2024.
Friend of the pod.
Very much a friend of the pod. And we always seem to have a similar theme, all about healthcare, and it just seemed like it would be rude for us to ignore what's going on at the moment in terms of in the United States. And you are, without doubt, one of the experts in Michigan when it comes to public health. So you've spent your entire career advocating for public health. How are you processing a second Trump term that's actively dismantling the Department of Health and Human Services? How's that going for you, Abdul?
Not great. I mean, I think for all of us in this space, it feels frankly, like a betrayal. I mean, nobody goes into public health to make a lot of money. Nobody goes into it because they want the fame or the fortune. You go into it because you feel like you have a responsibility to guarantee access to a longer, healthier, more fulfilling life for people. And the thing about public health is, by definition, you work in the background. Like, people don't think about public health as, being the folks who make sure that your lights are timed correctly so you don't get into an accident on your way to work. You don't think about public health as the people who make sure that some smokestack isn't destroying the air that you breathe every time you breathe in. You don't think about public health as the folks who make sure that there's not chemicals in the food that you eat. But that's work that public health is doing in the background. And I think we learned a lot about, our connection to two much broader subjects over the last 5 years since the pandemic. The first is our connection to politics. We sit downstream of a set of political choices and political actors that have not had our best interest and our collective best interest, given that, we show up to work for the public in mind. And then the second has been the information space, the media space. And we've watched as politicians have weaponized a narrative about public health, quote unquote, overreach in the moment where people needed public health the most during a global pandemic. And there's been a lot of attention paid to mistakes that were made, sort of like Monday morning quarterbacking, which 100% I understand. Like, there were a lot of mistakes made. There was not a perfect response. But also mistakes made in a setting, in a moment where our media infrastructure had been completely demolished so that we're all stuck in our own algorithms, and under political leadership that could not be trusted to make good decisions for all of us. And then the last point, that I think is just really important to draw out is also our relationship to healthcare. Mm-hmm. And I think part of the challenge for public health folk is that there is a lot of money to be made in healthcare. There are a lot of big corporations that make a ton of money waiting for you to get sick and then figuring out how to monetize you after you do. And the distrust that healthcare has created in our society around everything with the word health in it, I think has fallen back on us in some really important times. And so I think for a lot of us in public health, this ought to be a wake-up call about stepping into some of the bigger fights. And if you're not advocating for the people that you serve in public health, then a lot of folks are going to be advocating against you.
So there's been literally hundreds of changes made since the new administration came in. RFK obviously taking over as the Secretary for Health, which has, I know I've listened to your podcast, so I know that you've got thoughts. But what has surprised you most in terms of what you've seen happen so far?
I wish I could say that I was surprised. They've been setting up to do this for a while. I think the part that I'm surprised about is the speed with which it's all kind of happened, and the silence from folks who are not necessarily in public health, but who should be aligned with using science to make good decisions about how to protect people from disease. And I think it's in line with a broader strategic narrative that Trumpism, that everything underneath Trump is going to be so clearly self-immolating that you kind of don't have to do anything about it. And meanwhile, when it comes to public health, I don't think we got the time to wait. And I think the problem, frankly, is that all of this gets sieved through a political analysis by people who have both the privilege and the space to consume politics and civics as a sport rather than as a system that has like deep and profound consequences for all of our lives, and particularly those who rely most heavily on public service. And so it's frustrating to watch as, you know, the NIH is being redirected in ways where they continue to try and answer questions that have already been answered, you know, when it comes to science, to answer them in ways that comport with their ideological framework. It's frustrating to watch really great research get stopped in its tracks because, you know, a guy named Chris Rufo has an agenda to try and destroy universities. All right. And the thing that we all have to understand here is that this research isn't just papers published in journals. This research is research that could hold the key to unlocking the cure to some cancer. And there are going to be people in the future who die of cancers that could have been prevented, but for the failure to continue forward research that could have prevented it. And then, you know, the thing about RFK, and this is kind of maybe, you know, to get to your question about surprise, and maybe it's more frustration, but so many of us in public health have been talking about the problems that now all of a sudden people think RFK just discovered, right? Ultra-processed foods, the role of big ag and huge food corporations in feeding us things that we really probably shouldn't be eating in ways that we can't really avoid. The way he has been able to drive a conversation about chronic diseases that so many of us have been trying to have, and then the way that he gets the problem right and the answer so profoundly wrong, right? He's basically decoupled the problem from the approach to solving it, which puts science first. And so what we have here is public health policy by vibes. And I just wish more folks aligned with, you know, the role of science and truth in our society would be stepping up and fighting back a bit more.
I have a funny story actually, it's a sad story. I was at a campaign event at John James's office, not this last cycle, but the cycle before. And I met these two women who started telling me about this health regimen they do. And this one woman was swearing it cured her cancer. These women were telling me how they crush up ivermectin and put it in their yogurt and eat it every morning. I have it on camera. It's a true story. I swear to God. What's more stressful for you? Actually trying to do your job or getting out there and trying to combat the massive amount of disinformation that we're faced with on a daily basis? Because these are people we want to live healthy lives, and it's just like,
Yeah.
how do we get through to them?
You know, what's so sad to me, right? And this is a problem that pre-existed RFK's coming onto the scene. What's so sad to me is that all of us in public health and medicine seem to have lost trust in a way that has left people like them to be exploited by the likes of an RFK, you know? And this is that point about healthcare that I was making, right? I want you to think about the experience of somebody who has been disenfranchised in our healthcare system leading up to COVID-19. So you, let's say, suffer with diabetes, and you know that but for insulin, you might die. And you watch as corporations spike your insulin prices so that they can deliver a higher profit margin on a drug that's been discovered over a century ago, whose discoverer sold the patent for $1 and said, I quote, that insulin is for the world. And you struggle to have that insulin because of the goals of a pharma CEO. And then nobody from like official healthcaredom shows up and says, no, hell no, that's not right. And then all of a sudden there's a global pandemic and folks from official healthcaredom show up and say, hey, here's a vaccine. It's free for a disease you don't have, right? In a moment where all of a sudden you should be worried about this thing. So here, take this free vaccine. And you're like, wait a second. So you're saying that y'all couldn't show up to get me the medication I know I needed for a disease I know I have. And now all of a sudden y'all are showing up to give me a medication that didn't exist a year ago for a disease I don't yet have? How does this make sense? And the problem with it is that we in public health allowed ourselves to get marginalized out of these big fights. And public health built its bones, taking on big Goliaths and winning, right? Like the moment at which you have public health agencies actually popping up all over the country was in response to swill milk, right? Or poison slaughterhouses. And these were folks who were, putting sawdust in meat and putting like formaldehyde in milk. And their goal was to sell it to folks. And public health stood up and said, hell no, you will not do this. And they took on industry and they won. And then, fast forward a couple decades, and then you've got big tobacco. And public health showed up and said, hell no, you will not sell people poison under the guise of something that you're telling people will help them. We're going to stand up and we're going to fight. And the hard part to me is that, like, all right, 5 decades on, 6 decades on, we have sort of been marginalized out of the big fights that we should have been fighting. And so because we were marginalized out, it undercut, right, that trust that we had built over a long period of time as people you could trust to show up in the moments that that folks needed you. And I think that has led to a situation where we don't have the kind of trust that we should have had both through COVID, but then afterwards. And that opens up the door for folks like RFK to get out here and mis and disinform the public because of that trust gap that we let happen and we let grow.
Do you think now is the time for public health professionals to get in that fight? We've had like the CDC gutted, research funding gutted. Elon Musk and his buddies are running around stealing health data under Doge. Should we have health professionals jumping instead of writing the op-eds? Is now the time for people to just get in the streets and lead the resistance?
It's been time. I also think that is not even just about the political fight, right? I obviously have my opinions about the political fight, but I also think it's just not forgetting who we are in the sense that there are big public health fights that need to be won. I think one of them is on accessibility for healthcare. I think in public health, we've believed that we are not healthcare, right? And that we leave healthcare to the healthcare people, and instead we're the workers in the background. But when healthcare has become so corrupted by corporate interests that the people on the front lines of healthcare themselves are like, what are we even doing here now? I think it's time for public health to jump into the chat. I think the other part of it is, think about big tech. I mean, every single one of us carries one of the biggest public health hazards in our pockets.
Yeah.
In large part because you have $1 trillion plus corporations that spend billions of dollars to make sure that as much of your eyeballs and eardrums that you can give get sucked into these machines to sell you things you don't even need, which mean that it's harder and harder to look up from your phone, to look your child or your parents or your friends and your family members in the eye. They've figured out ways to intermediate all of our conversations in ways that leave us talking only to people who demographically look like us. They've literally frayed the foundations of our democracy, and our mental health has never been worse. And so, you think about the big epidemic of our time, like they are mental health epidemics, right? Whether you're talking about loneliness, or you're talking about substance use, or you're talking about depression, you're talking about suicidality, you're talking about violence, like all of these things sit downstream of, right, what we call a syndemic, right? Multiple epidemics at once, right? That sort of took a hockey stick in 2007. You know what happened in 2007? They invented the iPhone in 2007, right? Now, do I have a causal demonstration of that? No. But like sometimes correlation is causation, right? And I will say that if you just look at any of our lives, I don't think any of us are proud of the amount of time that we spend looking at our phones.
I certainly am not.
No.
No, and as a parent, that's something I consciously say, like, I am mirroring really bad behavior for my children. I do not want my children to spend nearly the amount of time on their phone that I do.
Do as I say, not as I do.
right.
Is that the motto?
But it's also something like, I just have to, I mean, I don't have much going for me in life. Like one of the things I used to have is a really good attention span. I used to be able to like put my nose into a book or put my nose into a thing and pay attention for hours and hours. And it's interesting, you know when that ended for me? Like ended for me after college. Now I happened to graduate college in 2007. And so like I've come to a point now where like I am literally spending time with the two people I love most in the world, and I find myself reaching for my phone. Like that is not healthy. And the thing about it is, I know I'm not the only one.
Yeah.
And I say this as somebody who had the privilege of growing up in a time before this existed. Like
Yeah.
I can't imagine what it's like for a young person whose entire existence has been in a moment where society pushes you and trillion-dollar corporations pull you, right, to believe that everything you need happens on this phone. That means that you can't get the thing that all of our ancestors have had for centuries, which is the ability to know that you can look another human being in the eye and be comforted by their existence in your space, right? Like that is an essential human need that we are getting pulled away from us. And that should be a public health fight. Like I want to see public health jump in and say, no, big tech, like you guys are the tobacco, right, of the 2020s, right? And we need to step up and have a conversation about where this ought to be and how to do this in a safe and effective way. And I think we're finally having that discussion, but you know who's not leading it? Public health is not leading it. And I just think that like trust is about when you show up and how you show up in moments where people know they're suffering, or sometimes it's how you show up to show people why they're suffering, even if they don't see it themselves. Like that's what we do best. And if we can't show up on those fights, then how are we going to have the trust, right? When we show up and we say, hey, we need you to do a thing to protect yourself, right? If we're not showing up and showing folks the most immediate and obvious sources of pain in their lives.
I've got a case study for that. I mean, my kids always on their phones, right? And as a digital director, I don't allow them to use social media, right? So they don't have Instagram or Snapchat, any of it, but they're on YouTube and YouTube Shorts all the time. I took my son's phone away from him for like a month, and I immediately saw his mental health improve, his just general well-being improve. He was just a happier kid who could sit and have a conversation around the dinner table all of a sudden, right? Like, absolutely. I mean, it was crazy. I was telling Julie, I'm like,
No.
he's a different kid right now. He's not getting his phone back.
Yeah, it is. It's unbelievable. And I think to your point there, Abdul, it does feel very much like they're not being proactive. We need people to be, the public health professionals to be proactive about this. You see what's going on, and to be proactive. And now I've kind of let it go to a point where there's other people filling that void, and that's what's happened.
Right.
That's what's happened. Hey, just to make a little bit of a turn here, is there anything that the media, because the media is a big part of this as well, right? Is there anything I'm noticing a lot? There's a lot that I see that they're not covering, which I think is far more important in terms of what's going on within the Department of Health right now, that really scares you. The whole, I always say to Gina, I've had this motto for a few years now, since Trump version 1 was watch what they do, not what they say. They're constantly throwing, shiny things at you while they're shitting in the corner over here. Is there anything that you're seeing that we're not hearing about that's really frightening you?
Nobody covers big bureaucratic reorganizations, but the Department of Health and Human Services is one of the biggest departments, aside from the DoD, frankly in the world. And they're restructuring it, and they're restructuring it to give a lot more power to the secretary in ways that there was a lot of effort put in to putting checks and balances into where funding gets spread. Because in science, right, we try to be led by evidence. And the idea is that you should allow the evidence to lead you as to where to make investments, both in intervention against ill health, but also in terms of where future research goes. And you're seeing a lot more of that get reorganized so that it's under the direct focus of the secretary in ways that I think can be really dangerous, both because it opens the door for corruption, but also RFK's made it very clear that his goal is to use HHS to justify a lot of his ideological premises. This is not a man who believes in the scientific process and wants to be led by science. Frankly, like you got a guy named Dr. Chris Hall, who is the NIH researcher who put the idea of ultra-processed foods on the map. This is something that RFK Jr. has been talking about now for some time because of the research of Chris Hall. Chris Hall just left the NIH because the director's office, RFK's office, literally tried to censor his research because it didn't fit with RFK's preferred articulation, right, of what he wants us to focus on when it comes to ultra-processed foods. I mean, that's crazy. And if great science is not being led by scientists, right, you're not going to get great science. Like, that's just how this works. And so I worry that as more of that decision-making is being left to the whims, right, of RFK Jr., we are going to be wasting that money. You want to know about waste, fraud, and abuse? Like, that to me is waste, fraud, and abuse, right? And we're not covering it because it's not sexy, right? Like, broad reorganizations are not sexy. But this is going to set back science and set back trust in HHS, I think, for decades. Because hard part about a lot of these bells is that they can't be unrung.
Yeah. It's hard to put the genie back in the bottle. Yeah. Now, one thing that really concerns me, having lived through, obviously, COVID and the pandemic, and as someone that lives in a different country from my family, I am so concerned about, will we even know when the next pandemic? Like, remember back in 2019, I was traveling a bit, end of 2019, early 2020, and I knew every time I got on a plane, it's like, oh, this is, this could be happening. But I'm really frightened right now that a pandemic could be right on our door and we won't even know about it with what's happening in terms of, like, stopping, freedom of the media, all sorts of things. So it's not just HHS. I mean, cutting of CDC, there's a whole lot of stuff going on.
They're not tracking things the way they used to. I mean, yeah.
Is that something that concerns you?
Big time. I mean, the Trump administration's approach to reducing the spread of disease is not to count it.
Right.
Which, that means your official record of disease is going to be low. And meanwhile, people are going to be suffering disease.
That reminds me of something that happened in North Korea during COVID-19.
and they wanted to make happen here, right?
Yeah.
So I worry a lot about, right now we kind of still have, we still have the emerging infectious diseases that were emerging at the end of the last administration, right? So you think about, H5N1, otherwise known as bird flu, otherwise known as highly pathogenic avian influenza, a bunch of names. As they get another thing in public health, we just got to get better at. And we're watching how it's spreading now. Thankfully, it doesn't seem like it's spreading too far or spreading in ways that are as concerning as they could be. That being said, we won't know necessarily the next one if there is not free and open exchange of information.
Okay.
Right. One of the worst things about the way that one of the worst things about the way that COVID-19 emerged is that it emerged in a totalitarian society where the authorities' first instinct was to cover it up rather than to be transparent and try and address it. Right. I wonder, had SARS-CoV-2 emerged in a place where the response was to say, hey, we've got this thing, here's where we identified it, here's what we think caused it, and what can we all do together to try and squash this? Is there a world in which we could have contained it? Maybe, maybe not, right? But it would have given us the best shot. I worry now that, in the United States, if that is our approach, right? If we're walking into authoritarianism and authoritarian governments have a tendency to ignore things that don't fit within the narrative that they choose, what might that then mean? And, that includes, in this case, defunding the World Health Organization, right? And, I just worry a lot about what that means. And then there's also diseases that already exist, right? That are already out there. Measles. We've got a massive measles outbreak, right? And you've got a HHS secretary who's telling people to do, quote, do their own research, right? And part of me is like, yes, the organization that you used to lead up, literally its entire goal was to flood the informational zone with shit such that, right, what people find, quote unquote, in their own research He's all this shit you put out there, which is mis and disinformation, so you could sell them onesies, right? That celebrate being unvaxxed. I mean, and so the problem is like the folks have to understand the grift. Like there is money to be made lying to people and then selling them snake oil. This is a thing that people have done for a very, very long time, right? And now all people do is dress it up in their own version of, oh, do your own research.
Yep.
And here we are.
Gina just mentioned to us earlier here today. What was the announcement this morning from Florida, Gina?
Yes, a young school-age child has a case of active tuberculosis. And I always tell Julie, MAGA's not going to be happy until they bring back the iron lung. And I don't want to see that in our future, but...
No, I mean, the other thing about it is, I just wish... I was talking to my grandparents. One of the first episodes of America Dissected was on the anti-vaxxer movement back in 2019, believe it or not, okay? And I was talking to my grandparents who remember lining up to get their Salk vaccine for polio. And I was like, well, did your parents have concerns about the side effect profile? They were like, yes, of polio. Mm-hmm. Like we saw those kids. Every single person knew a kid who'd gotten polio where there were irreversible consequences for them, if not death. And so, yeah, when there was a safe, effective vaccine, guess what? Everybody was like, let's line up and get that because we know what polio does. And the hard part about it is we have not seen a lot of these diseases for generations. So people then grow up thinking that like, oh, why do we do this thing? Well, because polio can take your life. So can measles, right? So can all these diseases that we ask folks to get vaccinated for. And I worry that we're headed back into that world where we're going to F around and we're going to find out. And it's funny, right? Because I've had, as you can imagine, hazard of my profession, a lot of conversations with people who don't quite believe that we have their best interests at heart. I'm like, don't talk to me as a doctor, okay? Like, forget that I went to school for this. Like, ask me as a dad.
Yeah.
All right? Because I got 2 kids.
Yeah.
And guess what? Like, when my kids turned 1-year-old, I made sure that the first appointment they did, we celebrated their birthday, right? By getting them jabs. Yeah. Why? Because I love my kids and I want them to live.
Yeah.
Right? And I know what these diseases do. And so as a dad, that's what I chose to do. Now, as a doctor, my job is to like get you to do the right thing for your kids. But you don't think that somehow, right, like as a dad, when it comes to the people I love the most, that we weren't doing exactly what it is that I'm asking you to do.
Once again, watch what you do, not what you say, and have a look at most of these people that were talking, the anti-vaxxers were getting themselves and their kids vaccinated at the same time. It's just rubbish.
Look at Donald Trump.
Exactly.
First in line for the vaccine, right?
Exactly.
But these people, they still have this other narrative in their head. I want to pivot for a second because we're thrilled to have you here because we know how busy you've been. You just launched your Senate campaign over the weekend. So double thank you for coming in because we know you're exhausted from crisscrossing the state. I'm super thrilled because you're one of the few people running on a Medicare for All platform. So I'm going to ask you this, but I kind of know what the answer is. Just last week, Debbie Dingell introduced and Bernie Sanders introduced Medicare for All Act of 2025. Is that something you'd sign on to?
Yes. I would love to be a co-sponsor.
Yeah.
Literally wrote the book. So look, it's a crazy thing that in the richest, most powerful country in the world, we have an active debate about whether or not we can afford to give people access to healthcare. That should be insane and wild to all of us. And the reason we still have an active debate is because there are enough corporations that make enough money that they are going to fight tooth and nail to tell you that somehow if we guarantee you healthcare, that you're going to lose something, right? Mm-hmm. And we also have an insane political system that allows those people to spend a lot of money to buy access to politicians who then will parrot that argument. And usually in politics, when there's a public consensus here and there's a political consensus here, the difference is somebody's money, right? And in this case, the difference is money that is spent to disinform the public around what they could gain and what they would lose, right, under Medicare for All. And what you would gain is freedom from like getting your pay garnished every 2 weeks or 4 weeks, right? A deductible, which is basically like you pay that 2 weeks and 4 weeks to get the privilege to pay them another $4,000 for the average family of 4 to get the healthcare you thought you already paid for.
We know people are stuck in jobs they hate because they can't afford to lose their healthcare.
And women are stuck in marriages, or people are
Yep.
stuck in marriages that they don't want to be in. Either way, just to have health care.
Yeah.
Just a reminder.
And this is the lot that we've condemned ourselves to,
Yep.
right? And we could do better.
I think what I want to sort of like tie this off with is then please don't be surprised when people get so disenfranchised and disappointed and start not trusting the system and the people when they feel like it's
Yes.
been put up against them. I mean, that at the end of the day, I think is it. That's the bottom line.
It's crazy to me because there's nobody out there telling me how much they love their insurance company, right? Like, that's just not a thing. But on the same time, they're like, well, I don't want to have to wait a month to get a doctor's appointment. And I'm like, that is not a thing. That is tale
No, guess
people
what, though?
tell.
In our system, you do.
Yeah.
You do. I mean, like,
I find it harder here to get an appointment
Yes.
with my insurance than what I do when I go back to Australia under the public system. And I'm happy to have that debate with anybody.
the average wait time to see a cardiologist, and by the way, like most of the time when you see a cardiologist is not just like for shits and giggles.
Right.
Right? The average wait time is like 2.5 months.
Yeah.
That's the average.
Yeah.
So you got like cardiac disease.
Yep.
Your ticker could like go kaplop
Yep.
at any time, and you're like, let me just wait 2.5 months because I've got great private health insurance.
And on top of that, you're paying for that privilege, right?
Yes.
I just want to remind everybody you're paying for that privilege of like, being a ticking time bomb for the next 2.5 months.
It's just every study shows the outcome. Like, you live longer in countries with universal health care. We pay more and we die faster. And I don't
Yeah.
understand why people fight this.
Unbelievable. Abdul, thank you so much for joining us.
Thank you for having me.
You're always a friend of the pod. We love seeing you. The one thing I want to remind everybody of and just say is what we love about you is not just your openness and your willingness to, have any conversation at all. It's the fact that, like we said before, you do what you do what you say and you say what you do.
Mm-hmm.
You definitely live this is how I treat my kids and this is how I want your kids to be as well. So thank you so much for joining us, Dr. Abdul El-Sayed. The podcast that you mentioned is your podcast called American Dissected. I highly recommend it. We'll put a link to it in the show notes. Gina, it's been a pleasure.
And thank you all for having me. It's always fun to be with you guys. This is the first time I've been here with you guys, and this is
Our new
fancy.
fancy
Yes,
space,
I absolutely
yeah.
love it. And I will say, there's something about a podcast where you actually get to see each other. It's just so much better. Yes. So thank you for inviting me to your space, and thank you always for hosting honest, deep, and rational conversation. Really appreciate what you guys do.
Thanks so much, Abdul.
And that's a wrap on today's episode of Point of Disorder. We'd like to extend a huge thank you to everyone who listened today. And if you like us, give us a like, a subscribe, or a review on any place you get your podcasts. And don't forget to follow us on social media at Distill Social and at The Guerrilla Politic. This is the Point of Disorder podcast, signing off. Stay sharp, stay progressive, and above all, stay tuned.